Hello and welcome. You're watching Medically Speaking NewsX, and I'm Vaishali Sharma. With me, Dr. Vipul Rastogi, neuropsychiatrist in the Institute of Neurosciences, Medanta. Welcome, sir.
Thank you very much, Vaishali.
Today, we are discussing an issue so pertinent that is common between and feeds on everyone, regardless of caste, sex, age, religion, privileged, underprivileged, physically healthy or not. Everyone faces their problem at least once in their lifetime. Yes, we are talking about the mental health issues on this Mental Health Day special. So, first, talking about the children, India's representative to the UNICEF, Dr. Yasmin Ali Haq, emphasized that what we know about the mental health conditions in children was just the tip of the iceberg. So it's commonly seen that many children go through a lot of neglect and abuse, especially in school when they face bullying, competition, pressure, etc. Children are even declared dyslexic. Taking the case of Abhishek Bachchan, as you must be aware, um, parents do not know how to tackle the situation. Have you come across such situations that maybe parents bring to you, and what, according to you, should be the parents' approach towards their child's mental health?
So it's a very good question. See, there are two things. Mental health has always had a lot of stigma. It is much better now than it has ever been. And hopefully over the next few years or a decade, everybody will start accepting that mental health is actually there and it is something to be concerned about. When we talk about, specifically children's issues, I think first thing that I would like to point out is ignorance. Now, when people do not know it, then they don't want to or they can't do anything about it. So, if nobody has told them about dyslexia, then the parents cannot pick it up. ADHD, again, something similar where the school performance is not great and children are put into the category of being naughty or, not responsible. Yes. So if the parents are not aware of it, then they can't do about it, anything about it. Similar thing is for the teachers. The awareness in teachers also has to be good because they can actually be the conduit where, they go and tell the parents that, look, something is not right and you should meet somebody who's a specialist for this. So first point is, of course, ignorance. The second point is the stigma, where people feel that no, this child can be corrected, or this could be, how can he not write, or how can he not read? Let's punish him and force him, and then he will be able to read and write, and whatever he has to do in school. So both the things are actually equally important here. A lot of help is available, a lot of awareness is available if people want to reach out. As you rightly said, it can affect anybody, right? It doesn't matter what caste you're from, what socioeconomic status you have, whether your parents are educated or not. And there are several reasons for it. So it is very important to, first identify it, second, accept it, and then, seek help, because that's how the child's future is going to get sorted.
Yes, sir. You rightly mentioned about the stigma around the problem, sir. One of the most shocking revelations of the report that was a report was that 14% of the people aged between 15 to 24 years, or 1 in 7 individuals to be rightly mentioning, reported feeling depressed or had little interest in engaging activities. It is noticed that people who suffer from this cannot identify that they are depressed and require professional help, and we can call it denial or stigma. How do you think should an individual identify that they're going through such a problem, and how do they break the stigma and approach a professional help like yourself, sir?
Yeah, so I think 1 in 7 seems appropriate. What is normally said is, 1 in 4 people will have some sort of mental disturbance at some point in their life. So 25%. Now we have to realize that this 25% doesn't mean that they're always unwell. It means they have a small, small episode and then they become okay. But most of the people will get touched in directly or indirectly by some mental health issues. It's not correct to say that the person who's going through depression is not able to realize it. Most of the people are able to realize because their functioning goes down, but they just do not know what to do about it. If they
Yeah.
go and tell their family members that, look, I don't feel positive, or I feel very depressed, a lot of times people are just told, pull up your socks. Kuch nahi hai, it will be okay,
Kuch nahi.
do this. Yes, kuch nahi hai. So those are the things that stop people from actually seeking help. But with the advent of, or necessity of having school counselors, school psychologists in most of the schools, So that point is getting sorted out now, because children can go up to their counselors, or they do mental health days, or they celebrate mental health weeks. So the awareness is coming back.
Just
And
I'll just interrupt you a little in between that. When you said that people are like there are help groups and counselors for children, many children come up with complaints like they getting bullied after approaching a counselor or something, that they're tum pagal ho something, like their friends bully them or some
yes.
sort of thing. So how can we break that stigma also?
Yeah. So something what we call as psychoeducation. So educating children and of course grown-ups about psychological problems. Now what happens is somebody says heart ki problem hai, right? So heart ki problem is not one illness. There are several heart issues that can impact. And similar thing is with mental disorders. There's not one mental disorder. There are more than 100 different mental disorders that are there. And when people use that word, which is very stigmatizing, pagal, which means person who is not in control of themselves. Now, there are illnesses where people may not appear to be in control of themselves, but that's a very minor thing. So out of 100 people, you see one you might put into that category who are absolutely, who lack insight or can't do much for themselves. But 99% of the people know that they're suffering. They know that something is not right, and they know something should be done about it, but they just don't know what to do.
Okay. They don't know what to do exactly. A very quick question to you on this, sir, that is there an efficient prevention for this mental health disorder, or is it the same for everyone?
So prevention is better than cure. If you are able to explain to people what stress is, what stress means, and how do you deal with that. So so children can pick it up themselves, or grown-ups can pick it up themselves and help themselves. So you know that English idiom, stitch in time saves nine. So if you have identified it, then you can actually start working towards managing your stresses better, because it is usually a long-term impact of stress that causes people to go into depression. It's generally not just one thing, but it's an addition of, or compilation of several stresses together that makes a person become depressed. So if you are, if you talk about the word depression, the word depression has lost its medical meaning. So when we talk about a person is medically depressed, that means their mood is down for at least 14 days. And it is something which is pervasive. So you see that depressive symptoms in home, in school, college, or with friends. Now, sometimes what happens is you've had a bad day and you can come home and say you're depressed. That is not equal to a medical depression. But if you're having too many of those days, then something is not right, and something should be done about it. If the children know, right, what does this mean, that they are also able to identify in their friends, they can help their friends also, and they will not be that stigmatizing, right? That look, you are pagal, you've gone to see a counselor. But school counselors are like teachers. Yeah, so I was saying, so the stigma needs to be broken at home also. And one of the schools that that normally call me for talking and helping their students, they do a mental health week. And on those days, they talk to students about bullying, they talk about depression, and they talk about other mental disorders, self-harm, that sort of thing. So that is how you bring up a change. Now when the child goes to say that, look, goes home and says, look, my school is celebrating a mental health week, then the parents are also forced to think about it. So and if two people know about it, then they go and tell more people around in their society, colony, family, friends. So, and that's how the stigma gets broken in the long run. So initiatives like those are very important. And today's World Mental Health Day, and newspaper is full of mental health things to do for themselves. If you go on social media, people are putting up things.
So it is a very common scenario when someone undergoes a panic attack, they're not able to recognize what is going on around them, because these attacks obviously come without warning. So
Yes.
how does one prepare oneself for such a situation?
Look, if somebody has had a panic attack before, then they know what it is. The first panic attack is, of course, very, very distressing, because sometimes it mimics a heart attack. And normally people end up going to hospitals and getting a lot of checkups done. But once a person has had it, then they at least have a better understanding of what happens when people have these anxiety episodes. Generally speaking, panic attacks do not come without a trigger. So people are able to identify what the triggers are, whether it's going in a lift or in an aeroplane, or it's some particular person or or it's public speaking. So then people are able to manage it, or so either avoid those triggers or try and manage them in a slightly better manner. Psychotherapy or counseling helps a lot, and for some people we might have to use medications for it. But yes, that's very true. The first episode is really, really distressing whenever that happens.
How does one know, sir, that when one is in need of a professional help, and how does one know that this can be, who is in need of psychotherapy, who is in need of counseling, who is in need of medication? And so also one question to you, that people are afraid, there's a stigma around this also, that people are afraid that mental health disorders are chronic. Once it occurs, it keeps on occurring on a continuum. So what do you want to say about that?
So, I mean, I would tell people that, look at your functioning levels. So if you are functioning at this level and now you're functioning here, then something is not right. And that is how we also judge the severity of the problem. So the more the impact on your functioning, the more severe the problem is. I would normally say people not to get bogged down with who they go and see first, whether it's a psychiatrist or a psychologist, or even their general practitioners, their family doctors, but do seek help because they'll be able to point you in the right direction. Generally speaking, one single session also helps where, people are able to tell you, look, you've had an anxiety episode, don't worry about it. So seek help, whoever you go to. And, if they're not the right people, they'll tell you who to go towards. As far as, the chronicity of illnesses is concerned, there are some illnesses which are chronic, which is no different than people having diabetes, blood pressure, thyroid issues, and you take medicines for life. But that is a minority. Majority of the illnesses are short-lived. They're secondary to a stress that a person has had in their life, and over a period of 6 months, 12 months, they're able to come off the medicines. When we talk about psychiatric treatments, I think it is wrong to say that psychiatric treatment means medicine. Psychiatric treatments is a combination of medicine, lifestyle changes, and therapy or counseling. They all have to go hand in hand for a better outcome. People who get stuck on medicines are those who do nothing else except take a medicine and feel it is okay. So if a psychiatrist also says to you, just take a medicine, it will be okay. I don't think that's right. Lifestyle changes are important. Medication, yes, in some cases we need to medicate people, but alongside counseling is also important.
Right, sir. So my final word to you, what is the message to the people this World Mental Health Day especially?
So I would wish people a mental happiness and satisfaction with life. I've used the word mental happiness because, people can have financial happiness or they can have a family happiness, not about mental happiness. So being content with where you are, what you're doing, having a freshness when you wake up in the morning, having a feeling of going to work or, tackling the day positive in a positive manner. I think that's what I'd like to wish them.
Really positive message from your side, sir. And really thank you for your time on this special day and for the special and positive message and a holistic approach to towards the people. And if we are able to break the stigma around the mental health of the people and normalize being not okay, not being all right, I think we'll consider our job done. And for more such important updates, keep following us and subscribe to our YouTube channel, Medically Speaking. Follow us on Instagram, Facebook, and visit our website, medicallyspeaking.in. Thank you for watching. Thank you for joining us. Thank you.
Thank you very much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.